Hemorrhoids, also known as piles, is a condition we're all very familiar with. But along with the embarrassment, hesitation, and fear, people have countless questions about this condition. What exactly is it? What are the symptoms? Why does it happen? Does it always mean surgery? Is it possible to treat it without an operation? Are there any home remedies? And can it lead to a serious, incurable disease in the future? Today, I'll try to answer all these questions in a very simple way. Stay with me until the end of this video. Piles is a very common problem these days. It's seen pretty much equally in both men and women. Medical research shows that once people cross the age of 50, the chance of getting piles increases by 50%. Basically, as your age goes up, so does the possibility of getting piles. Before answering all the questions, we need to understand what piles actually is. At the very end of our rectum, there are countless tiny veins for blood circulation. When hard stool from constipation creates pressure on the anal area, those veins swell up. The problem caused by the swelling is what we call piles. The scientific name for piles is hemorrhoids. These are mainly of two types: external hemorrhoids and internal hemorrhoids. External ones are easy to feel. During bowel movements, they come out a bit, so they're easy to detect. For internal hemorrhoids, 50% of patients realize they have it when they see bleeding during bowel movements, while the other 50% realize it when they feel pain. This condition is mainly divided into 4 stages. First stage, you definitely have piles, you feel pain and see bleeding, but it doesn't come out. Second stage, you have piles and it comes out during a bowel movement, but once you're done, it goes back inside automatically. Third stage, it comes out during a bowel movement, but it won't go back in automatically. You have to push it back inside using your hand or finger. And the final, or fourth stage, your anal cushions come out during a bowel movement, but even if you try to push them back in with your hand, they won't go back inside. Now, let's look at the causes, or who is most likely to get piles. It's usually seen in 7 categories of people. First category, those who spend more time than necessary on the toilet. According to medical science, a bowel movement should take between 1 to 3 minutes. Second cause, those who have been suffering from constipation for a long time. Third cause, those suffering from long-term stomach issues, including diarrhea. Fourth cause, if you work in a job where you constantly have to lift heavy objects. Fifth cause, if you are 50 or older, your chances gradually increase. Sixth cause, the tendency for piles is often seen in pregnant women. And the last and 7th cause, being overweight or obesity, is also considered a cause. Now, let's talk about the symptoms. Bleeding during bowel movements is a very common symptom, but keep in mind, this blood will always be bright red. This is because the bleeding comes from the anal cushions at the very end of the rectal area, so the blood doesn't have time to clot. That keeps it bright red. Also, remember one thing: if the bleeding is coming from your stomach, it takes a long time to travel down to the anal passage. As a result, it clots, and the stool can look black like tar. In that case, consult a doctor immediately. If you feel unbearable pain, do not go to the pharmacy and buy tramadol group medicines without seeing a doctor. Many medicines containing tramadol and paracetamol cause side effects like constipation. Also, we cannot take ibuprofen group medicines as they significantly increase the risk of bleeding. Another symptom is a slimy or mucus-like substance coming from the anal passage. You might feel itching, and even after going to the bathroom, you might feel like you need to go again. Now, let's learn about home remedies to get relief. To get relief from piles, we must stay away from constipation. A very good remedy for this is Psyllium husk, or Isabgol. We all know the name, but many don't know the right way to take it. Let me explain it briefly. Take the amount listed on the packet, mix it with a large amount of water to make a thin drink, and consume it after a meal. Drink plenty of water. Studies show that without enough water, it can block your throat or intestine, and we don't want to take that risk. We should also eat plenty of fiber-rich foods. Fiber helps prevent constipation. Foods like oats, red whole wheat flour, and red rice have lots of fiber, whereas white flour or white rice have almost none. Eat green vegetables along with beets, carrots, bell peppers, beans, and sweet potatoes. You can also eat chia seeds or flax seeds, which are rich in fiber. Drink plenty of water, but not all at once. Sip water throughout the day. Exercise regularly. If you are overweight, lose the weight. You can wrap an ice pack in a cloth and apply it to the area to relieve pain. Lying in bed with your legs raised can improve blood circulation and help heal the pain. Finally, never hold it in when you need to go. If you hold it, the water in the stool dries up, making it hard, which creates constipation. Now, when should we go to the doctor? If you see no improvement after trying these home remedies for 7 days, consult a doctor. If you are over 55 or have faced piles multiple times, you need to see a doctor. If pus is coming out, do not delay. If there is excessive bleeding, excessive pain, or a fever with shivering, seek medical advice quickly. And as I mentioned before, if your stool is black like tar, seeing a doctor immediately is mandatory. Finally, I want to say that piles is not an incurable disease. We call it a disturbing disease. We suffer pain and discomfort from it, but there is no chance of it turning into a serious incurable disease in the future. Many people say piles can cause cancer, but studies show that piles generally do not lead to cancer, so don't be terrified. Piles might be painful, but it doesn't lead to severe illnesses later on. I hope you liked this video. If you did, please like and subscribe to my channel. And don't forget to share your valuable thoughts in the comments section below. Stay healthy, stay well. See you very soon in a new video. Thank you.